Welcome to MarcusG.tv. I'm Chef Marcus Giuliano. I'm a chef on a mission. So I want to talk about a recent experience I had at a local emergency room, local ER at the hospital. I wasn't the patient. It was my mom. My mom went in the night before for some. My mom's okay. My mom went in for shortness of breath, and she's been bouting with, almost something like asthma for the last year or so. And my mom is 77. My mom is very determined. My mom is a very strong woman. She loves to do gardening and yard work, and loves to pick up rocks and move rocks at 77 years old. She'll stack wood. And I let her do it. My son goes and helps her. I'll help her sometimes, but my son Justin goes and helps her. She's sitting out there and she's working her body and she's really doing a great job. And I'm like, you know what? That keeps her young. That keeps her happy. She's moving muscles. Let her go for it. So she went to the emergency room about midnight the other night and with shortness of breath. They gave her a couple tests, gave her some kind of inhaler, nebulizer, I'm not sure. And of course she was discharged and went home. And they said, oh, come back and do some more testing. Come back to the hospital and get some more blood work done. So of course she went back to the hospital, to the ER, got some blood work done. Next thing I know, I'm getting a phone call from my dad. They're not letting your mom go. They're sending her to another hospital. There's probably something serious going on. And as my dad's telling me this, my mom is calling. So I answer the phone to my mom and I'm like, Mom, do not let them take you anywhere until I get there. Remember, you're the patient. You're the one in charge. Do not let them take you anywhere. My mom's fine, by the way. My mom's like, I want to go home. Like, what are they talking about? So I get there and, it's so incredible how these doctors just take control of your health. When you're the patient and you're the one who should be saying, well, I want to know all my options. What do you mean, what does this mean? They immediately come in. I ask the doctor to see the doctor. The PA comes in. He goes, this is high. And I go, okay, what does that mean? And he goes, it's just like, well, why do you want to know, basically? It's like, I want to know the situation. I'm like, you did blood work. What does the blood work say? He goes, well, this was high. I go, and how about the rest of the blood work? He goes, everything else was normal, right? So everything else was normal. So I call a doctor friend of mine. I call somebody who's a healthcare professional, and I start going over this blood work. But first I said to the doctor, I said, I want to see the printout. I want to see the printout. Because they weren't giving me the printout. They weren't giving my mom the printout. I said, I want to see the printout. I want to see the full blood work you did. They give it to me. I go in the lobby. I call my healthcare professional, my friend, a doctor, somebody who I go and I trust. And he starts going over all these things with me. And he's like, Marcus, this just isn't adding up. So I list the thing in the level, and he tells me what that means in the body and this and that. So we go down to 2 pages of stuff. And he's like, Marcus, your mom has an infection. She has a parasite. Her gallbladder, her liver, everything's being stressed out. She probably has acid reflux, does she? I'm like, yeah, she's had acid reflux. He goes, yeah. The way he explained everything just made so much sense. So I get back into the room, and they're like, well, you ready to go? And I'm like, we're not sure we're ready to go. And they're like, well, what do you mean? She has to be transferred to another hospital. And I'm like, we'd like to have a meeting, a little family meeting, because my dad is there. So we'd like to have a family meeting and decide what our options are. He's like, well, I don't understand what the problem is here. I'm like, we'd like to know all of our options. Doctors aren't used to patients telling them or asking them, well, no, I don't want to do that. No, I want a different answer. I want a second opinion. I want a different opinion. So, of course, my mother's primary care physician, who's my primary care physician, I called him and said, are you aware that, my mom is in a hospital and this and that? And he knew a little bit of it, and he's the kind of doctor, he's a great doctor when it comes for me telling him, give me other options. I don't want to do this. I want something less invasive. I want to do something more natural. He's a medical doctor. He might not know everything, but at least he's open to that. So, so this PA, this physician's assistant who's in there, is saying, your mom had a heart attack. And I'm like, well, what do you mean she had a heart attack? Well, this test here, I'm like, that's the only thing there that's indicating she's had a heart attack. And that's not even an accurate test to begin with. He goes, well, chances are that could point to mean she did. I said, you just changed your language. You came in here, you said she had a heart attack. Now you're saying that she needs further testing because there's one marker, there's one indicator, nothing else, there's no other indicators that she may have incurred some kind of heart stress or a heart attack. And he goes, well, I don't know what your problem is, or what is your problem? I said, my problem is the whole medical system here is a scam. The cholesterol thing, the invasive techniques they do. I mean, I'm like, what in the world are they going to do for my mom? She's going to go to another hospital. I said, their job is to find something wrong. I said, she's going to go to the hospital, you're going to wire her up, do all these things, and you're going to find. That's how you guys make your living. I told the doctor flat out in the ER. I said, that's what happens. I said, so we're discussing our options, because I don't know if my mom wants to go through them. My mom's like, I'm ready to go home. My mom's like, take this stuff off. I want to get out of here. My mom's blood pressure was high. It was high. And I looked at my mom and I said, Mom, did you drink water? When was the last time you drank water, Mom? She's like, it's been hours upon hours. And I said, Mom. So I called the nurse. I said, can we get some water in here? So she gets these little 8-ounce water bottles. She gets 4 of them. And I made my mom drink 3 of them right then and there. And, she's hooked up to the blood pressure. As my mom's drinking this, and afterwards we're waiting, we're talking, all of a sudden her blood pressure starts to drop. Didn't drop much, but she just drank the water. I said, Mom, if you're dehydrated, your blood is thicker. It's going to take your body more to pump the blood. Okay? Now, granted, her blood pressure was quite high. My mom has always had high blood pressure when she comes into doctor's offices. She'll go home, it's fine. She does her blood pressure at home. She just has white coat syndrome. And so she'll get into a doctor's office. My mom is the kind of person who freaks out about everything. I mean, I remember as a kid growing up, it's like she was always worried about where I was. I was like, Mom, you just have to relax. You're going to raise your blood pressure with all this. We would always say that it's just not healthy for you to keep worrying and stressing out. She'll stress out over everything. And, if she finds that, she needs to go get something, she'll like run to it. I'm like, Mom, you don't need to run. Relax. It's not that bad. Just relax. My mom will misplace her keys or misplace her wallet like she did a couple weeks ago here at my restaurant. Misplace her wallet. I knew she had misplaced it. She left it at the bar. And she's freaking out. I'm like, you've got to relax. What's the worst thing that can happen? You had your wallet 10 minutes ago. The stress is going to kill you, Mom. The stress is bad for you. Your wallet was here 10 minutes ago. You're not going to be able to accomplish anything by stressing out. So just relax. We'll all look for it, and I'm sure we'll find it. But my mom is the kind of person that's like, and it's just that's how she's always been. So of course, when she gets into the doctor's office, she's so stressed out, and I believe that she probably has white coat syndrome, and her blood pressure goes. She checks her blood pressure at home, and it's fine, perfectly fine, but much better than she is in the doctor's office. So as I'm giving her this water, I said, just sit back and relax. And of course, as I believe the water is taking effect, because what happens is your blood gets thick. When you're dehydrated, your blood gets thick, and it takes that much more work on your body to pump. So sometimes simple hydration can lower your blood pressure. Simple hydration of water. So I said, this is the first thing that they should have done. Is should have given you tons of water. Let you drink tons of water, but this isn't on their mind because they don't make money giving patients water. They make money giving patients drugs and invasive therapies. Now, I'm not against doctors. I'm not against emergency rooms. I'm not against hospitals. I'm not against all that. They serve their purpose and they come in very handy. What I'm against is the overuse of drugs, the over-testing of stuff, because their job is to find something wrong with you so they can profit and make money. Okay, they wanted to send her on an ambulance ride to a hospital half an hour away. Why can't we drive her? Why can't we drive her there? Well, it's all part of this system. I'm like, Mom, I don't care if your insurance pays for it. So, somewhere along the line, somebody's paying $3,000 or whatever it is for you to go in the ambulance. She goes, my mom goes, no, I've got to pay a portion of that. I'm like, they just don't give you options. It's like, you're in our care now, and this is it, and this is the way it's gonna be. And you've got to remember that it's your decision. And you could tell they kept coming back. I'm like, we're still talking. We'd like some time. Don't send an ambulance. Don't do this. We're deciding what we're doing as a family here. And I told my mom, the most important thing when you decide, I looked at my dad, I said, you have to totally be comfortable with what I'm telling you, with what these tests say. So my healthcare professional friend went down the whole list, and he's like, Marcus, there's things in here that are raising flags to me. He goes, but it has nothing to do with her heart. Nothing. He goes, your mom has an infection. And he explained everything to me. He goes, this can explain a lot. The shortness of breath, the acid reflux that she has so bad. I'm like, my mom has terrible acid reflux. He's like, well, this is how everything fits together. So as I'm back in, the doctor comes in one more time. I said, okay, we went over this, and you said this was important. I said, but I'm noticing these other few things in here that are elevated. What do those mean? He goes, oh, those aren't important. I said, what do you mean those aren't important? Those are elevated, and those must mean something because you tested for them. Oh, no. I said, but you tested for those. So why would you run a test for something that you don't care about the results of? I said, because those mean something. And I left it at that because he didn't tell me what it meant. He didn't tell me the whole connection of everything. So the point of this whole thing is you're in control. You're the ones who have the destiny of your health. You're the ones who have the destiny of what happens to you when you go into the hospital. And I got to tell you, he came back in and he goes, you've made your decision. And my mom goes, I'm going home. He goes, I don't recommend that. She goes, no, I'm going home. I'm discharging myself. Well, and he's like, when are you going to the doctor again? When are you following up? And I looked at him, I go, is that important? I said, it's 9 o'clock at night. How am I supposed to give you definitive plans that we're going to see a doctor tomorrow at 9 a.m.? I said, we can't make an appointment right now. I said, I called a couple of people. I called her primary health care. Well, what does he think? I said, he knows exactly what I think and how I think. So we're comfortable with her leaving. Well, he goes, I need to know where she's going. I said, she's going home. And we have no plans as of right now. She will seek medical attention, other medical attention. She will go. But my mom goes, I'm not going tonight. She goes, I'm going home. My mom was really dead set. My mom was like, I'm going home. Screw this. I'm out of here. So my mom is very strong when it comes to that. My mom took the conversation right over, and she's like, well, why do you need to know? I'm going home. And he's like, well, you're my responsibility. And I'm like, well, if you're her responsibility, don't you think we should have talked about some of those other things in that test that were elevated? If you're her responsibility, don't you think that there's other things you can be doing? Don't you, it's just like, if you're her responsibility, let's do what we can while we're here. Let's talk about other things and at least give my mom some water. She's dehydrated sitting here. It's still 85 degrees out. It's still like peak weather here. And even though it's fall, I said it's still, let's talk about some of the basic stuff that's not being taken care of for her. You gave her cranberry juice filled with sugar. Why would you give somebody cranberry juice filled with sugar? This is sitting right here. It's just the mindset of these doctors, and it's not their fault. I have nothing against doctors themselves. It's the paradigm, it's their system that they're brought up through. It's the system of their medical training, which isn't their fault. Honestly, doctors mean good. Doctors enter the profession, in my belief, to help people because they want to make a difference and they want to help people. But when you start putting pharmaceutical money into education, and there's so much profit in medication, it's hard to really look after the patient. Let me tell you something. It's easier and much more profitable to give drugs than to give water to somebody. And it's like, my mom needs water. Give her some water. It's like, this is ridiculous. Let's get the poor woman some water. She's dehydrated. But there's other things in this test that we're showing, but is there not enough money in that? I mean, it's like the biggest thing right away. And he's like, well, she's going to need the catheterization and this and that. And you know what happens when you go to these heart doctors, these cardiologists. They start hooking up all this stuff. These tests are designed to find stuff. These visits, you can't keep these surgeons in business. They can't pay for their degrees. They can't pay for their education if they're not practicing what they're taught. So, bottom line is, my mom went home. My mom is fine. My mom does have follow-up appointments with some healthcare professionals, with a doctor, and with an alternative. We've already got the alternative doctor booked. So my mom has the other stuff coming into place. But we're all not stupid. We all know that what we do, the food, our thoughts, even this morning I'm running past my mom's house, and I stopped to see the dogs, and I'm running with my buddy, and I stopped to my mom. I'm like, you know, Mom, did you drink your lemon water this morning? She's like, no, my mom doesn't really drink lemon water. Whenever I've been telling her the importance of drinking lemon water, and especially adding ginger to it first thing in the morning to alkalize your body and do a bunch of awesome things. And she's like, well, no, I don't have time. I'm like, but Mom, but you took the time to drink coffee, didn't you? And she's like, yes. I'm like, well, if you took the time to make and drink coffee, you can take the time to make and drink lemon and ginger water. It's just that simple. It's our priorities. And my mom's like, I really eat good. I'm like, Mom, let's break your diet down. Let's talk about what you're eating. And you know, when somebody says I eat good, the first thing I ask them when they say is I eat good, I'm like, did you eat a pound of greens a day today? They're like, well, why would I eat a pound of greens? That's ridiculous. I'm like, well, because greens are healthy. And if you eat a pound of greens a day, you're eating healthy because there's not enough room or there's not much room for other junk food. So a pound of greens a day is super important. That's what I tell people. A pound of greens a day. Start with that. I got to tell you, just eating a half a pound of greens a day, and where I got the idea about a pound of greens a day was the 80-10-10 book. But if you eat a half a pound or a pound of greens a day, there literally isn't much more room to fill yourself up on other junk food or other dead foods. And the foods might not be junk foods, it might just be dead calories, dead food, even though they might look healthy on the surface. And a lot of people are eating food that just looks healthy on the surface. Oh, Cheerios, it has this, and this because it says it on the box. Yeah, well, that's like very manipulated, dehydrated, highly processed, highly refined, highly sweetened crap. It might say it's heart healthy. It might say it has vitamin C. It might say it has fiber. It might say it has, and you might think it's healthy because it's low in calories and it's low in fat, but it's really just dead food. That's all it is, just dead food. So the point of this video is you need to take charge when you're in the hospital. And I've told my dad this for years. My dad is the person who goes and just, whatever they say, oh, you need this, you need that, he's like, okay. But they scare you so bad. You don't need to be scared by your doctor. You need to stand your ground and say, I'm discharging myself. I'm doing this. I'm the patient, and this is what I would like. If I have to sign a waiver, let me sign a waiver. But I'm handling it the way that I'd like to handle it because, again, I'm the patient and I'm in charge. I'm Chef Marcus Giuliano. Thanks for watching this video. If you like my videos, please hit like, subscribe to my videos, subscribe to my channel, pass it on, leave some comments, and that's it. Thanks.